I would like to welcome ACS members to the American College of Surgeons Pathways to Fellowship interview series. I'm Lindsay Kilgore, a breast surgical oncologist at the University of Kansas Cancer Center and an associate fellow member of the American College of Surgeons. The committee has developed this new fellowship pathway series to spotlight surgeon leaders who have championed the pathway to fellowship for young surgeons. The goal of the interview is to help promote the value of fellowship within the American College of Surgeons and amongst its members, especially those in subspecialty fields of practice. This interview will be published in the Resident and Associate Fellow newsletter and will be made available as a podcast accessible from the ACS website. Joining me in conducting this interview today is a medical student committee member, Quinn Losevsky. Quinn, could you please introduce yourself?
Hi, I'm Quinn Losevsky. I'm a medical student at the TCU and UNTHSC School of Medicine in Fort Worth and a member of the American College of Surgeons.
Great, thank you. Dr. Ellen Bogan, I'd like to start with you. Could you please tell us a little bit about yourself and your work history and current role?
My name's Rich Allen Bogan. I'm the professor and chairman of neurological surgery at the University of Washington and the director of the Neuroscience Institute at the University of Washington. And I have been a fellow, for many more years than Lindsay, you've probably been alive, so I hate to say that. But I started my career in the military as an Army neurosurgeon at Walter Reed, and I joined the American College of Surgeons because it was extremely pertinent to me back in the early 90s.
Well, welcome. We're honored to have you. Dr. Babu, could you please introduce yourself?
Sure. I'm a neurosurgeon in Florida in the Treasure Coast. I work for Cleveland Clinic Martin Health, and I've been with the college since I started residency. I was involved with the Resident Associate Society, and that's how I first got to work with Allison and a bunch of great folks. And I'm actually a new initiate for the upcoming meetings. So I'm very excited to join as a fellow, join the college as a fellow.
Congratulations on getting your FACS. That's a big deal. So I'd like to start actually by what does ACS fellowship mean to you all and to your institution?
I'm sitting at Harborview Medical Center, which is one of the busiest trauma centers in the country. And really, in order to do my job as chair of neurological surgery, I have to be integrated into the American College of Surgeons system for evaluating trauma systems. And I think they do it better than anybody else in the world. And I think the success of what we do is predicated on knowing the systems that the American College of Surgeons has set up over the last 100 years or so.
I think it's important to be a member of the college and be a fellow of the college. It's really, I think, attending American College of Surgeons meetings, but then also participating in discussions and committees, as Dr. Ellen Bogan mentioned, really important for the House of Surgery. I mean, there's a lot of issues that affect all surgeons. And I think increasingly, as we're becoming more specialized and subspecialized, we don't necessarily have the opportunity to speak to a lot of our colleagues. The Surgeons Lounge is disappearing. We don't have an opportunity for crosstalk and sharing concerns. And I think that means our voice gets diminished. And I think what's helpful within the House of Surgery is to be able to discuss concerns that we all share as surgeons and hopefully discuss strategies that we can use to overcome the challenges we see in our hospital, getting, different stakeholders involved, whether it's a quality issue at our hospital or trying to improve care in an outpatient facility. So I think having other voices that we can tap and being able to make those connections and join with other surgeons is really important, especially for a subspecialty like ours, which is smaller than our general surgery colleagues.
Thank you both for those great answers. Our next question is, how has affiliation with the ACS affected or helped your career path and helped you as a specialist?
I mean, go back to the mission of what the college is. It's about improving the quality of care. If you're a very patient-centric sort of approach to doing clinical medicine, what the college does is elevate the bar. It's about professional competency and excellence in education and in patient care. So what is there not to love about that mission?
How have you championed ACS fellowship at your institution and specifically with your specialty of neurosurgery?
I think a couple different ways. One, I think promoting any of the college events or online events, I guess now in particular, sharing those with colleagues, but then also folks who are juniors, so trainees, residents, and fellows. And I think it's helping our colleagues understand why the college is valuable.
Dr. Ellen Bogan, how have you championed ACS fellowship, not only at your institution, but within the neurosurgery field as a whole?
Well, I started when I was in the military. As you know, the American College of Surgeons was founded by a military surgeon. The military surgeons sometimes feel outside the group of academic and private practice neurosurgeons. And so they needed a place to belong. And I'd go to meetings and I would discuss the issues that were pertinent to military surgeons. And I trained a generation of military neurological surgeons that I'm very proud to say that most of them went off and became fellows of the American College of Surgeons. This is an educational society. It's important to educate other neurological surgeons on the way we practice military medicine and the way we deliver care in the military. And there are enormous overlaps between what we would do in an evacuation hospital and we do in a level 1 trauma hospital. So that is one thing I do like about the ACS, that it tends to be a meritocracy of the people that commit the most and give the most back to this educational and professional society seem to advance in it as well.
A question for the both of you guys. What would you tell your 20-year-old self at the beginning of your career about fellowship in the ACS?
That this was something that I had to do in order to maintain my standards of practice.
And I think that when we try to ask ourselves, why are we a member of the college and not another organization, or why is this valuable in and of itself? I think the question really gets pushed back on us is, how do we get involved with the college and how do we shape it into the organization we want it to be and focus on the issues that we find the most important? Because I think what happens is we get so lost in all the sub specialty differentiation, and we're thinking more along education, we lose our ability to advocate. Because that really takes a lot of voices coming together.
That's great. So, what are 3 takeaways for our surgeon colleagues on how they can address their career path and membership in the American College of Surgeons?
I think the takeaways for me would be that if you want to maintain and elevate the standards of care in a particular area that you practice, that being a fellow of the American College of Surgeons is certainly one of the more attractive pathways for you to pursue, because it's a brother and sisterhood of fellow surgeons that are not specifically siloed because of the care that they practice.
The takeaways for me have been, 1, there are innumerable ways to get involved with a college. 2, I think that it becomes more and more important to get to know folks outside of your own discipline. We don't have an opportunity to really share our pain points and really organize and unify our voices. This is a great opportunity for advocacy across the House of Surgery, but unless we have a unified voice, we're not going to be able to make a dent in our own little corner of the world. And then I think the third area is just, I've been so impressed with the college in particular when it comes to surgical education, the shared issues we have. So for instance, dealing with scope of practice issues from, for instance, mid-level expansion to just other groups trying to use the term surgeon when they shouldn't be. I think that we do share a special bond, even if we don't train in the same discipline. And I think that can't be overstated. And I certainly feel a strong sense of pride whenever I leave a College of Surgeons meeting, because I do feel like I'm a member of a larger community. So I think those are my personal takeaways.
Those are great. Do you all have any other comments for our listeners about the college and getting involved, particularly within neurosurgery?
This is an opportunity for surgeons to form colleagues outside of their own subspecialty. So if you're a collaborative sort of surgeon, this is a nice home for you.
Well, thank you all so much. You guys gave some great advice and insight. We really appreciate you taking time to be here today. I know our viewers and listeners will all really appreciate it. So thank you again.